Thank you everybody for coming in. Today we're dealing with Dao Chan, a 53-year-old male that presented with weakness and was later diagnosed with severe acute motor axonal neuropathy. He's currently in the respiratory ward but was previously in ICU, and he's requesting a discharge. So we're the community health team and we need to figure out how this discharge is going to happen and what we're going to be doing for Mr. Chan. I'll serve as a GP and monitor any signs of deterioration, any side effects he will be having from his medications, and also perhaps arrange with a psychological consult with regards to the important aspect of mental health and what his goals are and what he wants to be achieving. So I'll be doing that, and his home environment will also need to be fitted for him now because he's functionally different than he was before, and occupational therapy. How do you think we should proceed with that?
Yeah, you're right. It definitely needs some changes around the house. So I'll go in there to assess the house, just make sure it's all set up for him and any equipment that he's taking home is set up properly, and also that he and his wife have the education they need to make sure it's used in the best way. I'm going to reduce any risk of him getting pressure injuries and things like that. In the long term, we'll also be working with him, set some goals, what he wants to get back to doing, and we'll work on retraining and getting strength back up so he can get back to doing some of the things around the house and eventually getting back out into the community, back to some social things as well, maybe even back to work if that's what he wants to do. We'll also need to make sure that he's very healthy and that he's looked after, and so I'll be liaising with the nurse regularly to make sure that all of that's going well. There's nothing else we need to arrange for him. Yeah, you've got a plan for that?
Yeah. So the community nursing team, I guess we'll mainly focus on his wound management, particularly those blisters on his shoulders and his thighs. We'll also focus on his pressure sore care, especially while he's not so mobile. We'll need physio's help for that. Is that alright?
Yeah, so we definitely need to take into consideration his pressure sores, considering that he is on obstetrical mechanical ventilation through a tracheostomy, so he would be bed bound during this time. So we need to educate the patient on the importance of offloading that pressure and the different positionings and different bed surfaces that we need to take into consideration.
You can maybe arrange for an air mattress for him too to help reduce that.
Perfect.
Yeah, so our aim right now should focus on leading him to a lesser form of ventilatory support, and once his respiratory function has improved, we'll definitely move on to improving his mobility.
Great. Just to try and make him a little bit more comfortable while he's at home, we'll probably try and work on his personal care, educating himself and his wife regarding oral hygiene, and probably assisting with his enemas. Maybe a bit of focus on his medication compliance and monitoring his NG tube, but we'll need some help from pharmacy with that one.
Yeah, I've noticed that he's on quite a few medications, and as a community pharmacist looking after Mr. Chan, I would like to see how he's going with his medications, and also wanted to find any side effects and see if there's any interaction with his medications and his feeds that he's currently on with his NG tube. But I did hear that his swelling has improved, and so I would like to monitor his transition from the NG tube to tablets or liquids. What do you think of this as a speech pathologist?
Yeah, so I'll have to assess his current swallowing status to see if he's having any difficulties. Hopefully we'll then start on rehabilitation so that he's able to take more oral intake. I know that moving back to a normal diet was also something that he wanted. I'll also have a look at his current communication. With his respiratory status, it'll be hard to move him back to voicing. I'll talk to the OT about his motor difficulties and see if he's able to access his electronic speaking device currently. The dietitian isn't here, but I'll have a chat with her and see if a change in his diet will have an effect on his nutritional status.
Yeah, and maybe we can liaise with social work as well and see what we can do from there. He has stabilized over the past 3 weeks, so I think we are in a position to perhaps allow him to be discharged and monitor him closely for any changes. Are we in agreement?
Yeah.
All right, thank you guys. So Mr. Chan, how does that plan sound? The community team is behind you. We want to help you achieve your goals and your independence. I do understand you have some concerns, and you and your wife may have some questions that need to be answered about how you're going to progress from the hospital setting to your home setting and what kind of changes will be there. And that's something that we can discuss, both you and I, or you can discuss with certain members of the community health team. We want to help you achieve your goals and achieve your independence, both in the short term and in the long term, and have you continue to be as healthy as possible.